types of math problems that are important to think about. And again, as clinicians, the important thing is not going to be the actual numbers, but the idea of kind of the proportions between internal and external moments are important. So here's a femoral head, femoral neck, greater trochanter, lesser trochanter. We're not really interested in it, but it's there. Tabulum. Now I'm going to say some stuff, and if it seems horribly obvious, it's just because in the past other people have made exactly those mistakes, right? Okay, so all the interesting hip problems have to do on the weight-bearing side. So, for instance, if we see a Trendelenburg sign, and a Trendelenburg sign is a dipping of the opposite hip of the non-weight-bearing. A compensated Trendelenburg, or a gluteus medius gait, is this. We were talking about this before, and again, it's on the weight-bearing side. So I'm doing it on the right. My left side could be fine. So that is what we're thinking about. We're thinking about the weight-bearing side with this. Okay, so remember, if we're thinking about single leg weight-bearing, okay, the center of mass is not quite in the center. The center of mass is, so say that we're looking at a person from the front. So this is the right side, correct? So the center of mass would actually be a little bit over to the left, because it includes not just the head, the arms, the trunk, but it includes the head, the trunk, the arms, and the opposite leg. That's why that's called the Hattel leg, H-A-T-L, head, arms, trunk, and opposite leg. So the center of mass is this, from the frontal plane axis of the hip joint to the center of mass. And say together, this is what? Actually, huddle first, and then tell me. So huddle, what is this that I've just drawn in? And in case there's any question, I'm talking about this. Villainous rascal. So this is and not quite the external moment. It's actually the external moment arm, right? Okay. So from here, and then there's gravity, and you may huddle again if you need to, Riley. But this is an external moment of what? What motion? Of the hip in the frontal plane. Very good, exactly. This is the, in fact, okay, so that's an external moment of hip abduction. So if the force of gravity of the Hattel weight, and you know, we tend to use weight and mass interchangeably. They're really not. But in this case, it actually is the Hattel weight, because weight is a force. The mass times the acceleration of gravity is 500 newtons. And let's see. So I'll go ahead. And the distance between the center of mass and the axis of rotation, which is in the femoral head, is 0.2 meters. Okay, so the external moment, who has their calculator ready? Show of hands, and everybody has a calculator on their phone. Sure, John will do it for right now. The external moment is 500 newtons times 0.2 meters equals what, John?
100.
100, what's the unit?
Newton meters.
Newton meters. You remember Newton meters is the unit of torque. So 100 Newton meters of torque. Okay? All right. So if the person is like this here, then the pelvis is able to maintain pretty much straight horizontal. What is the internal moment? Okay, you're right, but I want somebody else to. So think about this a second, and then somebody answer me. What is the internal moment? I think I heard a female voice over there. It might have been Katie. Okay. Oh, it was Carson? Okay. Sure, sure. Okay. Okay, well, let's go with Katie and Angela. Not Angela? Abby, I'm sorry. Abby, right? Okay, Katie and Abby. Okay, so what is the internal moment? What is the internal moment? No. The external moment is a moment of adduction. If we're maintaining a static equilibrium, what is the internal moment? First of all, what direction is it? And what is the magnitude? So go ahead, Carson.
Well, if you're maintaining a neutral movement, then it's going to be the same amount of force.
Yeah, that's right. That's why it's called static equilibrium. So the internal moment, the external moment is 100 Newton meters. The internal moment has also got to be 100 Newton meters, but in the opposite direction, which is what? Adduction. So you have an internal moment of 100 Newton meters of abduction. So let me use another color here. So the external moment is going in this direction, and so the internal moment is going in this direction. Okay, so if the length between, and there's actually several muscles, but we'll just say it's the gluteus medius. So the length between the axis of the hip and the attachment of the gluteus medius on the greater trochanter, if that is 5 centimeters or 0.5 meters, we have 100 Newton meters divided by 0.5 meters, which equals what?
200.
No, not
Wait, I
200.
did that wrong.
Bless you.
2,000.
2,000.
That's what I meant.
2,000. So that is what the muscles are generating in order to maintain that static equilibrium. 2,000 newtons. Okay, so stay with me for just another minute or so. So we've got this 2,000 newtons of force being generated by the muscles. So there's a couple things that are interesting that are going on here. Let's go here again. We're going to look at the hip joint in up close. Okay, so we have 2,000 newtons. Okay, and some of that is pulling up, and some of it is pulling in. Right? Okay, how much is pulling up? How do we know? So that's the rotary force, which is, and oh, one more thing that you need to know is the angle. So here's the angle of alpha, and we'll say the angle of alpha equals 70 degrees. Okay? So how much is pulling up? Shall I help you? Okay, so we talked about this last semester. So the rotary force, which is this here, is 2,000 newtons times sine, because it is vertical, right? 70 degrees equals what? So, Will, can you be my calculator buddy now? We've been picking on John.
Yeah. Alright. So we're doing, sorry.
Okay, the rotary force. The force that is bringing the iliac crest to the greater trochanter.
So sorry.
Okay, which is 2,000 newtons times the sine of 70 degrees. Okay, yes, Kelsey, go ahead. What's that? Okay, so the rotary force equals 1,879, right?
Yeah.
79. And last thing we're going to do, I promise, and then I'll let you go. So the compressive force is 2,000 newtons times the cosine of 70 degrees. And that's how much is jamming, how much is being generated by the gluteus medius that is jamming the femoral head into the acetabulum. So if this is a really arthritic joint, it's a problem. Okay, but go ahead. What is the force? 680 what?
4.
Equals the compressive force equals 684 newtons. Okay. I suspect we'll be thinking about this stuff some more, but I want you guys to be well rested, hydrated, and nourished for the rest of the week.
It's at the ilium, the sacrum, the coccyx, and the sacrotuberous ligaments, and then it goes and inserts on the gluteal tuberosity, and it's innervated by the inferior gluteal nerve.
Hold on, it also inserts into the IT band.
Yep. And it's a primary hip extensor. So in order to test that muscle, I'm going to have Tyler lay prone. Good. I'm going to have him.
Matt, if you could do it from the other side, then people would be able to see more easily. Okay, there you go.
Have him flex his knee a little bit, and then extend his leg up. And I'm going to stabilize him back here, and then add resistance. He's got a good glute max.
All right. Okay, now hold on. You did that well, but I have a question. Why do you flex the knee? And you're correct to flex the knee, but I want to make sure everybody knows why.
Because, like you said, the glute max attaches to the IT band, which goes down and inserts on the...
Okay. All right, I'll give you a hint. It has more to do... So remember, when we do a manual muscle test, we can almost never completely isolate a muscle, but we can emphasize certain muscles by changing the length-tension relationship of other muscles. So what else is a hip extensor?
It's a external...
No, what else? I'm sorry, what else are hip extensors? What other muscle group are hip extensors?
Like what other muscles are hip extensors?
Yes, sir. The hamstrings, that's right. So the hamstrings are also really important hip extensors. And so by flexing the knee, you're putting the hamstrings into a position of relative active insufficiency. Very good. Okay, good.
The hip would include the glute median and the TFL. So to test that, I'll have him scoot back a little bit. And then he's going to internally rotate at the hip. So we'll hold right here.
Okay, and what is the innervation of those guys?
That's the superior gluteal nerve.
Okay.
So I would apply a force trying to push him into external rotation at the hip.
That's good.
And then the external rotators, that would include the superior and inferior gemellus, the quadratus femoris, obturator internus, and the piriformis.
And the glute max.
glute max.
The glute max is the most powerful one and has the longest moment term. So it is the most important of the external rotators.
Okay, so to test those, I would put him in external rotation, and then I would apply the force this way, and he would resist. So for the adductors, the grouping is the adductor brevis, longus, and the magnus. So those are going to originate from the inferior pubis and ischial ramus. It's going to go down to
The pubic ramus. Well, let's see. No, you're right. Forgive me. Go ahead.
okay, and then it's going to insert on the linea aspera all the way down to the adductor tubercle for the magnus. So to test this, I would have him flex his knees at about 60. I'm going to place my hands in between his knees, and I will say, push into my hands. Okay, and that's for the adductor group. And for the gracilis, that's going to originate on the inferior pubic ramus and insert down to the superior medial surface of the tibia. So for this, I would have him roll over into prone. So the gracilis aids in adduction, medial rotation, and it also helps flex the knee a bit. So I'm going to have him flex his knees, and I will have him internally rotate at the hip, and then abduct his legs. So,
Wait, sorry.
so move your knees out of it. There we go. So I'm going to stabilize at the knee, and I'll have him push his knees into my fist. Okay, that's for the gracilis.
I have glute med and glute men, and so the glute medius attaches from the gluteal surface of the ilium to the greater trochanter, and the glute men is right inferior to that, and they're both innervated by the superior gluteal nerve, and they both adduct the hip and also do internal rotation. And then I also have the IT band, which attaches from the iliac crest to Gerdy's tubercle, and it's innervated by the inferior gluteal nerve, and it helps stabilize the knee and also resist adduction. So the way to test the glute med and glute men, you have the patient sideline, and then I'm going to have him adduct and slightly internally rotate, and I'm going to stabilize at the hip and also at the knee, and I'm going to have him resist me. And then to test for tightness of the IT band, I'm going to have him come to the edge of the table, and I'm going to grab his leg and slightly extend it, and if the IT band is tight, he wouldn't be able to drop his leg whenever I press on it.
There's a word for that.
He wouldn't be able to adduct.
Bingo.
And that's it.
Exactly. Okay, good.
Psoas, the rectus femoris, and the tensor fasciae. So she's going to lay backwards, and we're testing the length of them, so you're testing for anterior tightness. So she's going to bring her legs to her knee, or her knees to her body. Then she holds one of them and drops this leg down. So if the leg, or if the knee has to extend, then it's the rectus femoris that's tight. If it adducts, it's the tensor fasciae that's tight. And if it externally rotates, it's the iliopsoas that's tight.
So it's a long strap muscle starting ASIS running down diagonally to the pes anserine on the tibia. So it does hip flexion, hip flexion, knee flexion, and then a little bit of abduction. So what we'll do first is bend the knee and the hip and then slightly abduct. And then, so you're going to try and extend the knee and extend the hip at the same time. It's a little difficult because it's such a small or thin muscle, so you can't really rely on it being this sole muscle that you're testing, but this is the primary method. So we're going to start here, and then I want you to try and keep your leg in this position. All right, ready, go.
Okay. And then what you would do in order to test is do right versus left. So you're right in that the sartorius is certainly not strong enough to do that motion all by itself. But if there's injury, you'd be able to detect a right-left difference in that combination motion. Okay, good.
And then for the TFL, so that starts up at the iliac crest and then blends into the IT band. So that is going to slightly flex the hip and abduct it. So what we'll do...
There's a transverse plane motion also.
It also externally rotates, but when we...
Mm.
No, because it's anterior internally, I'm sorry. So the patient is going to be, yes, internally rotated, and so I'm going to have you straighten your leg. So slightly flexed, abduct, and internally rotate, and then so you're just going to do the opposite of that. So I'm going to press down, so don't let me move your leg.
So as goes from the iliac crest in the lumbar vertebrae to the lesser trochanter. So it flexes the hip and it's innervated by the femoral nerve. So what I'll have Nate do is he's in sitting, and then I'll have him flex his hip as I apply pressure right here. So, good.
Okay, hold on.